As a nationally recognized leader in the healthcare field, Intermountain is committed to developing innovative healthcare systems that provide our patients with the best in medicine. Our teams engage every day to solve health problems and improve patient care. At Intermountain Healthcare, every employee plays a role in healing for life, especially our IT department. You see, information technology professionals at Intermountain directly impact patient care. They are behind every bit of technology used at the bedside, as well as cutting-edge research data that helps clinicians provide the best outcomes for their patients. The results of IT work done at Intermountain Healthcare can mean saving a life, improved health in our community, and being seen as a leader in finding solutions to healthcare issues nationwide. Our IT team enjoy many benefits, including options for health and dental coverage, educational assistance, and matching 401k savings plan contributions to help plan for their future. Hear now from a few of our IT professionals as they describe the meaningful and diverse work they do to support the Intermountain mission of providing excellent care to the people of our community.
As a clinical modeling engineer, I map and model data, so I get it ready so that the programmers can use it to present it on the screen to the clinicians.
We support clinical research that doctors are trying to fulfill with different technology solutions.
I work with all different areas of Select Health and Intermountain to really understand what they need different products to do, different interfaces.
And my job is to go in and say, did they create it the way they were supposed to according to what the business needed?
I'm an MD. I have a master's in informatics and public health. But in our team, we have a very broad range of skill sets.
I have a bachelor's of science in nursing, and so I have practiced as a nurse.
Well, my background, even though I'm working in the information technology field, is actually in accounting.
I started in the industry about 27 years ago. I had an opportunity to start at Intermountain as a computer operator.
Although I did code for a while, it was not my cup of tea. And so business analyst work lets you kind of put it all together on the fringe, so to speak.
I think there's kind of a misconception with IT that people have to be introverted computer geeks, but it takes all personality types.
You have to have a personality that you like to work on hard problems, and that you also have somewhat of a creative nature to yourself.
But more importantly, it's the aptitude. And that's the most critical thing we look for, is the fact that somebody is willing to learn new stuff. They're passionate about what they do. In this case, taking care of our patients.
We do consider that we are improving patient care at Select Health, even though we are in the insurance side.
Members of our plans are members 24/7.
When you're working in healthcare, it's a little different than the skill set maybe if you're working on a banking system or designing video games, because we have people's lives in our hands.
We had one clinician that was a little bit skeptical, but they actually did run their patient through an electronic protocol for pneumonia. Within about a 20-minute time frame, that patient's condition started to severely degrade, and they would contact us back saying, boy, I was going to treat this patient as an outpatient, and I'm so glad that I had this tool available to me to actually change my decision.
One example is an infant that was sick in a rural area, and they did an EKG on the infant and labs and decided the baby was sick enough to be transferred to Primary Children's Hospital. They uploaded the EKG and all the lab information was transferred into our system, and the physician at Primary Children's has directly stated that his being able to look at the record all together and in such a rapid fashion saved the life of the baby.
I've worked on the My Health project, and I've seen the results of saying, hey, if we implement these security controls, it will allow us to make better use of our technology.
What the infrastructure we're building right now is aimed at reducing redundancy. It should drastically improve patient safety.
We're trying to help with the industry in a whole because we're trying to rein in the costs that we've been seeing as the healthcare industry in general.
When I do my work, it has real-world meaning. My family and the patients are the end result in the sense that things are working right, and things are kept private.
What I enjoy about my job is I get to work autonomously as well as in a team.
Intermountain not only really values its employees, but it encourages its employees to keep up to date with the trends in technology. They really care about me as a person and my career.
Beyond the paycheck, there's a stability, there's a camaraderie, there's a sense of purpose.
If you want to work on cutting edge stuff, bring it on. I mean, we can show we work on that. In fact, I mean, if I were to put it in one word, I think Intermountain is one of the best kept secrets within Utah or the nation.
Intermountain is involved in this national effort called the Continuous Care Consortium. And it's this initiative to try to share healthcare information across institutions. The mission, the vision, the values of Intermountain are consistent with my personal mission, vision, and values, and we translate that into the services that we provide. And so when people go home and they're dealing with their day-to-day challenges, it's nice to know that we're helping them in areas that are truly significant, truly meaningful.